Hello there. I'm Dr. Thomas Gerber, Associate Editor and Web Editor at Mayo Clinic Proceedings. I'm also a Professor of Medicine and Radiology at the Mayo Clinic College of Medicine. I'm here today to tell you about the Editor's Choice and Highlights articles in the October 2016 issue of Mayo Clinic Proceedings. This month's Editor's Choice is an original article about physician attitudes regarding maintenance of certification. This article was written by Dr. David Cook and colleagues from Mayo Clinic in Rochester and the University of South Carolina in Columbia. The authors conducted an internet and paper survey among a national cross-specialty random sample of licensed U.S. physicians. They found that only 12% of the respondents thought that maintenance of certification activities were well integrated into their daily routines, and 81% believed that maintenance of certification activities are a burden. And what's more, 38% of respondents met criteria for being burned out. So the results from this review confirm that dissatisfaction with current maintenance of certification programs is very common and not specific to any sector or specialty within medicine. I think as long as these negative perceptions remain unresolved, we cannot expect optimal physician engagement in the maintenance of certification process. The accompanying editorial entitled "The Evolution of Physician Certification and the Canary in the Coal Mine" was authored by Dr. James Puffer, the President and Chief Executive Officer of the American Board of Family Medicine. The first highlight in this month's issue is a review article authored by Dr. Mandeep Singh from Mayo Clinic in Rochester and colleagues from Mayo Clinic and from academic medical institutions in Boston, Massachusetts, and New York. This review addresses in detail the challenges that are involved with choosing between multiple potential therapeutic combinations of antithrombotic and antiplatelet therapies that, on the one hand, minimize the risk for recurrent ischemia without, on the other hand, unduly increasing the risk for bleeding. This review article comprehensively synthesizes available information to provide our readers with an in-depth knowledge of contemporary antithrombotic therapy that will help you make individualized treatment decisions for your patients. Another highlight in this month's issue of Mayo Clinic Proceedings is the newest contribution to our ongoing Symposium on Pain Medicine. The article on anorectal and pelvic pain was written by Dr. Adil Baruka and Dr. Tae Lee from Mayo Clinic in Rochester. This comprehensive review focuses on the three most common functional disorders associated with pelvic pain: functional anorectal pain such as proctalgia fugax, interstitial cystitis, and chronic prostatitis. The review discusses overlapping similarities and differences between these three entities, pathogenetic factors, and above all, symptom-guided therapy. And there, the importance of multidisciplinary approaches such as lifestyle modifications and pharmacologic, behavioral, and physical therapy are all discussed in detail. You can get up to 1 hour of CME credit for reading this review if you complete the appropriate documentation. The third highlight in this month's issue is a commentary with the provocative title, "Murder Liability for Prescribing Opioids, A Way Forward." This article was authored by Dr. Tony Yang from George Mason University in Fairfax, Virginia, and Dr. Rebecca Haffajee from Harvard Medical School in Boston, Massachusetts. Going from a recent case in which a California physician was convicted for murder in 3 patient drug overdose deaths and sentenced to 30 years to life in prison, this commentary explores the criminal liability for prescribers of opioids. The authors believe that the prospect of facing criminal charges may deter the so-called pill mills from engaging in irresponsible opioid prescription practices for monetary gain, but they also explain why effectively addressing opioid misuse in the United States, yet avoiding undertreatment of pain, will require going beyond just the criminal justice system and focus on more judicious and informed opioid prescription practices in all contexts. And I'm sure you remember that you can access these highlights and editor's choice articles that we just discussed on our website free of charge during the entire month of October. There is a lot of other free content on our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. We update the website very frequently and you'll find something new and interesting to look at almost every day. You can also stay in touch with us on Facebook, Twitter and YouTube. As you know, we use our social media channels to keep you up to date on online first publications that come out on the website between the monthly issue updates and on news stories related to articles that were published in Mayo Clinic Proceedings. And finally, to also host our video content such as the full author interviews or our 60-second video article summaries. Thank you so much for watching. Enjoy the fall colors outside wherever you are, and we'll see you again in November.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.